doctor? Because I know for a fact that when you're a fast bowler, for example, that there is a lot of pressure put on the spine.
Yeah,
and
because you're turning your spine,
yes.
And then they'll invariably have...
how can they manage that type of pain?
It's mostly, unless they prolapse their disc, mostly they are muscular or facet joint problem. I know this English fast bowler was here, I forget his name, who had facet joint problems and had to go back to England. It's quite sad that he had to fly back to get a facet injection done. It was in not this series, the series before. He was the opening bowler for England. I forget the name. But then it is available here now. We come to your doorstep, and then and also then you can do epidurals. All epidurals has to be under X-ray and dye. So epidurogram, where you put your dye, give a printout to the patient. When he goes to see another consultant, you show him the picture, and the other person should know what is done. I don't like these blind techniques, because you tell the patient you had this, you never know whether you had it or not. Yeah. So the needle should be in the right place. You should prove that with dye, and you must be very honest and give that printout to the patient.
I see.
Yeah. If you can't do that, you shouldn't be practicing this. So epidural from neck, cervical epidurals, thoracic epidurals, lumbar epidurals with the dye. Take the printout, give it to the patient. And if you don't get better with that, there's no point doing another one. But sometimes it gives you pain relief for 6 months, 1 year. Then of course you can repeat. Yeah, I have a Formula 1 driver coming to me for repeated injections. I don't invite him, but he keeps coming. Doctor, can I have another one? Can I have another one? So, so these are things, and then you can do for facet joints after the injections. If they work very well, we can do radio frequency, which is we can burn the small nerve root supplying the facet joint by heat and current. I need to bring this machine from England, I think. So that is another thing on a long term. Treatment. And then you've got other treatment like you can do root blocks where a disc is bulging and pressing on a nerve. The nerve swells like a limb. There's inflammation. So what happens when the disc is pressing on the nerve is swollen. So what happens, the nerve is touching the disc more and more, and it gets swollen more and more. So you need to break the cycle. To break the cycle, you do a root block. You put a needle in, and you locate the nerve by putting a dye. Okay, and then you inject the steroids and whatever, and then steroids are harmless if it's 1 shot or 2 shots. Yeah, and also a sportsman can have a steroid injection by someone who's qualified, and the sports medicine authorities will take that as a treatment. Okay, and then you can block that nerve, and then probably the inflammation heals, and it gives the nerve more room, and the symptoms disappear. And these are all alternatives to surgery. And surgery is the last resort, and there's no guarantee that the surgery will help the back pain.
And on that note, yes, I think you have a patient who is going to come here and join us here in the studio, and you will be discussing some of his history as well as the problems that he's going through.
So do join us right after we go into a quick commercial break, and we'll be right back with Dr. Senasinger and his patient.
Good morning, Sri Lanka. You're joining me, Amaya, on a very informative Monday morning. We're in discussion with Dr. Namal Senasinghe, and he actually has a patient that he has not examined yet and has not been treated by him actually here in the studio with us today. So doctor, please introduce us to your patient, Mr. Asanka. Thank you so much for being here with us today.
බොහොම ස්තුතියි අසංක අපි මේ අපිත් එක්ක මේ සම්බන්ධයෙන් ආවට අසංකගේ වයසයි මට කියන්න මේ මම මේ ප්‍රශ්න කරන එකට මේ මහජනතාව දකින්න එකට අකමැත්තක් නැහැ නේද?
නෑ කැමැති දකින්නට මගේ වයස අවුරුදු 35යි මට දැන්ට අවුරුදු 20ක ඉඳන් මේ අමාරු තියෙන්නේ දෙපාරක් ඔපරේෂන් කරා ඒත් තාම සුවයක් හම්බුන්නේ
හරි මං so he's a 35-year-old gentleman and presenting with back pain for the last since age of 20. So for the last 15 years he's been having back pain, and I'm going to ask some key questions from him. අසංක දැන් මේක එක්කෝ පටන් ගත්ත ඔයාගේ රස්සාව මොකද්ද?
මං කාර්මිකංශේ රස්සාවක් කරන්නේ.
Yeah, so he works as a mechanic. මොන කාර්මිකද? වාහන
motor mechanic.
Oh, he's a motor mechanic, and වාහන හදනකොට මොනවද බර උස්සනවද මොනවා වගේද?
නිතරම එන්ජින් උස්සන්න ගියපොත් ඒ උස්සන්න තියෙනවා බර නිතරම ඉස්සෙනවා.
Oh, so he lifts heavy stuff daily when he was very young, and probably so I'm now thinking that it might be a traumatic cause for his back pain. Then මේ කැක්කුම එකපාරටම දාවේ.
ටික ටික තිබුණා කැක්කුම මන් දිගටම වැඩ කර මේ වේදනානාශක බිබී ටික දවසක් ඊට පස්සේ මේ කොන්දේ මේ පැත්තෙන් පටන් අරන් කකුල දිගේ කරන්ට් එකක් යනවා වගේ කැක්කුමක් යන්න පටන් ගත්තා. ඊට පස්සේ වැඩක් කරන්න එහෙම බැරුව ගියා. එහෙම තමයි පටන් ගත්තේ.
So this gentleman has started acute on chronic back pain. So the onset has been very acute, and his classical symptoms are pain in the back going down the leg. As I said, it's the typical words he used, like a current. So that's the key word. So it's a red flag, as I said. So that's
as
some
you mentioned before.
your patients be concerned about this sort of presentation. In passe මොකද කරේ? ඒක එක්කම වේදනානාශ කරන් ඊට පස්සේ මොකද දුන්නේ?
කැක්කුම දිගින් දිගටම බේත් ගත්තට අඩු වුනේ නැති නිසා ඊට පස්සේ වෛද්‍යවරයෙක් හම්බුණායින් පසුව එයා මට MRI ස්කෑන් එකක් ලියලා
වෛද්‍යවරයෙක් හම්බුනේ අසන?
ස්නායු ශල්‍ය.
ඒතකොට නිකන් ඒ පළාත් දොස්තර කෙනෙකුට පෙන්නේ නැද්ද?
මුලින්ම පෙන්නුවා දිගින් දිගටම පෙන්නලා හක්කලා බැරිම තැන තමයි ස්නායු ශල්‍ය වෛද්‍යවරයෙකුට පෙන්නුවේ. ඊට පස්සේ එයා මට මේ MRI ස්කෑන් එකක් කරන්න කියලා ලියලා දුන්නා. ඒ ලියලා දීලා හක්කලා බලලා කිව්වා ඩිස්ක් දෙකක් ප්‍රශ්නයක් තියෙන කියලා ඔපරේෂන් කරන්න ඕනේ කියලා.
So he's been to normal general practitioner in his local area. The pain has not gone down, so he's seen a neurosurgeon in Colombo, one of the main hospitals, and then he's quite rightly he's ordered MRI scan of his lumbosacral spine, and then he's mentioned that he got 2 discs prolapsing.
So what do you think could be the cause of his
it's a classical problems? He describes the classical symptom. In a layman's term, it's sciatica, but it's quite a layman's term. Sciatic nerve is formed by 5 nerves, but then this is probably 2 nerves touching the branches of the sciatic nerve. The disc touching, probably a disc prolapse touching the sciatic, 2 branches of the sciatic nerve on the right side. So I'll see the MRI scans later and see what his problem is. In passe මොකද කරේ මේ මහත්තයා?
ඊට පස්සේ මට MRI ස්කෑන් එක කරලා ඊට පස්සේ ඔපරේෂන් එකක් කරන්න තියෙනවා කියලා කළා කරා. ඒ 2002 අවුරුද්දේ ඒ ඔපරේෂන් එක කරත් මට කිසිම සුවයක් හම්බුන්නේ නැහැ. ඊට පස්සේ දිගින් දිගටම
දැන් ඔපරේෂන් එක කරේ කොන්ද කැක්කුම තිබුණාද ඒ දවස්වල?
කොන්ද කැක්කුම තිබුණේ නැහැ.
කකුලේ කැක්කුම තමයි.
කකුලේ අර කරන්ට් එකක් වගේ යන කැක්කුම තමයි තිබුණේ.
So the operation has been quite rightly done for the right reason, pain shooting down the leg and not for back pain. Right. In passe මොකද උනේ? ඒක හොඳ උන්නේ නැහැ.
ඔපරේෂන් එක 2002 ඔපරේෂන් කරා හොඳ උන්නේ නැහැ. ඊට පස්සේ දිගින් දිගටම ක්ලිනික් මේ වෛද්‍ය සායන වලට ඉදිරිපත් වුණා. ඒ ඒගොල්ලෝ බේත් දුන්නා. ඒ කිසි දෙයකින් සුවයක් වුණා. ඊට පස්සේ නැවතත් 2007 අවුරුද්දේ නැවතත් මේ ඔපරේෂන් එකකට ගියා.
ඒ වෛද්‍යවරයාමද නැත්නම් වෙන වෛද්‍යවරයෙක්?
නෑ වෙන වෛද්‍යවරයෙක්.
ඇයි මාරු කරේ වෛද්‍යවරු?
වෛද්‍යවරු මාරු කරේ ගොඩක් වෙලාවට දැන් ගියයින් පස්සේ දිගින් දිගටම යනකොට ඒගොල්ලෝ මට තේරුණා මේ නිකන් අතෑරලා දානවා වගේ එහෙම
එච්චර උනන්දුවක් දැක්වේ නෑ.
උනන්දුවක් මං ගැන දැක්වේ නෑ.
ඒතකොට දෙවෙනි වෛද්‍යවරයා ළඟට ගියාම එයා උනන්දු වුණාද?
එයා ඊට පස්සේ එයාත් මුලින්ම ආයේ මුලින් ඉඳන් MRI ස්කෑන් එකක් කරලා ඊට පස්සේ ආයේ එයාත් බලලා කිව්වා ඔපරේෂන් එකක් කරන්න තියෙනවා. මේක කරන්න පුළුවන් කියලා. ඊට පස්සේ ඒ වෛද්‍යවරයා එකතු වෙලා මේක ඉවරයක් කරගන්න නිසා ඔපරේෂන් එකට ඉදිරිපත් වුණා. නමුත් ඒ මුලින් හිටියට වැඩිය සාමාන්‍ය මට්ටමකට මේ සුවයක් ලැබුණා. නමුත් 100% සුවයක් හම්බුන්නේ නැහැ.
සුවය ලැබුණා කකුලේ කැක්කුම.
කකුලේ කැක්කුම පොඩ්ඩක් අඩු වුණා.
ඔව්. එතකොට දැන් කකුල ටික දවස් යනකොට දැන් අවුරුදු 10ක් විතර දැන් 15 කැක්කුම.
15ක්.
දැන් කකුලේ මාංශ පේශීන් වල දුර්වලතාවයක් හරි හීනතාවයක්. ඒ කියන්නේ මේක මේ මස් ගොබ අඩු වෙලා තියෙනවා. දිය වෙලා වගේ ඉහළ තියෙනවා.
මේ කකුලේ මේ පල්ලෑ කොටස මේ හීන වෙලා තියෙනවා. මේ අනිත් කකුලේ
මොන පල්ලෑ කොටසද?
Doctor, can you take us through what he's saying now? What he has said so
now
far?
he's saying that he had a surgery in 2002. The symptoms were not relieved. The main symptom was pain shooting down the right leg. Then he waited for another 7 years and he had another surgery with a different surgeon because he thought the first surgeon was not that interested in him as before. So he's changed fair enough, he's changed the doctor, and then the new doctor has shown some interest and suggested that he needs another surgery and operated, and then he said the symptoms improved slightly. Again, කකුලේ කැක්කුම ටිකක් අඩු වුණා.
පොඩ්ඩක් අඩු වුණා.
Yeah, symptoms have increased slightly. හැබැයි දැන් මේ ඔපරේෂන් එකෙන් පස්සේ දැන් ඔයාලට කොන්ද කැක්කුම තිබුණේ නෑනේ.
නෑ.
දැන් කොන්ද කැක්කුම තියෙනවද?
දැන් කොන්ද කැක්කුම තියෙනවා. විනාඩි 5ක් වගේ හිටගෙන ඉද්දි මේ කොන්ද දෙපැත්තෙන් කැක්කුම පටන් ගන්නවා.
So now what's happened is that this is a chap This is a 35-year-old gentleman who presented with pain shooting down the legs, had 2 operations. First operation didn't help him, second one helped him slightly, but he's left with a back pain which he never had.
So on that note, doctor, I think Mr. Asanka will be joining us again next week as well to go on.
Before that, I need to show I need to tell exactly what was wrong with him. Can I do that?
Or can we save it up for next week maybe?
Okay. Yeah, that's fine.
Because I think we need to wrap up the show for today. And thank you so much, Dr. Namal Senasinghe, for being with us here today. And also thank you, Mr. Asanka, for giving us time from your valuable time as well. And for those of you who would like to directly contact Dr. Namal, he has kindly made available all of his contact details. So you can contact his PA in Sri Lanka on the direct number 0779 838 450. That's 0779 838 450. And you have also made available the contact number for your PA in the United Kingdom. So that will be 0044 78117 16399. 0044 78117 16399. So make sure that if you do have any consultations and you feel that you should show your back pains and any other aches and pains that you have to a doctor, then we have our very own consultant who has decided to come back to Sri Lanka and to share his expertise with his mother country as well. So make sure that you do contact him on these special numbers. Thank you so much, Doctor, for being with us here today. And I think this has been a very informative and interesting Monday morning for all our viewers. So thank you so much for taking some time off your busy schedule. And for a very special announcement will be that Dr. Namal will be joining us every Monday to speak about different parts of the body, different pains that you can get in different parts of the body. So do make sure that you join me and Dr. Namal in discussing some of these more mainstream pains as well as post-surgical and headaches, diabetic neuropathy. We'll be even covering things like facial pains, which are not very well known in Sri Lanka. So all of these pains will be covered on the show, and on every Monday there will be a special segment with Dr. Namal. So thank you once again, Dr. Namal, for being here with us. And that's it for our show today, ladies and gentlemen. So thank you for being with us, and thank you for keeping yourself tuned in, and we will join you again tomorrow at the same time, and have a good morning.